What is blood cancer? A blood cancer is a disease in which abnormal blood cells reproduce rapidly and begin interfering with the body's usual operations. Cancers of this type originate in the bone marrow, where red blood cells, white blood cells, and platelets are produced. There are 3 primary blood cancers: leukemia, lymphoma, and myeloma. What types of blood cancer are there? The 3 most common types of blood cancer are leukemia. Leukemia is a cancer of the white blood cells, which your body produces to fight disease. It results from the overproduction of abnormal cells, weakening your immune system and also limiting the creation of red blood cells and platelets. Lymphoma. Lymphoma is a blood cancer that attacks the lymph nodes, which is another important part of your immune system. Healthy cells, called lymphocytes, are replaced by abnormal lymphoma cells. The buildup of cancerous cells in the lymph nodes reduces your resistance to infection and disease. Myeloma. Myeloma is a blood cancer originating in plasma cells. The latter are white blood cells that create antibodies. The spread of abnormal plasma cells lowers antibody production while increasing susceptibility to disease. Myelomas typically form tumors in the bone marrow. What are blood cancer symptoms? Blood cancer symptoms include weakness and fatigue, loss of appetite, flu-like fevers and chills, joint pain, rashes and itchy skin, swollen lymph glands, weight loss without apparent cause, dieting. For example, night sweats, regular infections, frequent bruising and bleeding, headaches, breathing difficulty, abdominal irritation or discomfort. There is some variation among symptoms, depending on the type of cancer. Leukemia. Symptoms of leukemia vary on the type of leukemia. Common symptoms include chronic fatigue that does not improve with rest, bruises easily, blood clotting issues, frequent infections and high fevers, unexplained weight loss, swollen lymph nodes in the neck, armpits, and groin. In children, common symptoms include anemia, bruising and bleeding, getting infections easily, weight loss, lymphoma, lumps, painless swollen glands in the neck, collarbone, armpit, or groin regions. Some of the swollen lymph nodes can press on organs and cause pain in your chest or belly and trigger coughing and breathlessness. Fever, unexpected weight loss, myeloma, nausea, fatigue and exhaustion, bone pain, breathlessness, myelodysplastic syndromes, MDS, anemia, bruising and bleeding issues, infections. Myeloproliferative neoplasms, MPN. There are 3 types of myeloproliferative neoplasms. They are polycythemia vera, PV, essential thrombocythemia, ET, and myelofibrosis, MF, PV. Symptoms can include headache, blurred vision, skin changes. Many people experience no symptoms and are often diagnosed only after a blood test, ET. Often people do not experience symptoms. However, older people with low platelet counts can experience symptoms of persistent or repeated headaches, disturbed vision, dizziness or ringing in the ears, bruising and bleeding easily, erythromelalgia, fingers or toes turning blue or feeling cold. MF. Symptoms may include breathlessness, difficulties fighting infections, and unusual bleeding and bruising. Additionally, you may experience fatigue, chest pain, headaches, tinnitus, belly pain, night sweats, fever, and weight loss. Women and blood cancer. Although men and women exhibit fairly similar symptoms with blood cancer, there are sex-specific symptoms and women's issues that are important to know and discuss with your doctor. One of the symptoms women can have with blood cancer is heavier or irregular menstrual flows. Your period may be much heavier, or you may notice bleeding in between cycles that is usually more than just normal spotting that can happen. What causes blood cancer? Medical researchers have yet to determine the cause or causes of blood cancers. Possible contributing factors include genetics, Leukemia appears linked to certain genetic disorders, such as Down syndrome. Family history. The chance of developing a blood cancer increases if other family members have been diagnosed with the same or a similar condition. Smoking. Smoking is correlated with an increased incidence of several cancers, not limited to the lungs. Weakened immune system. Weakened immune systems are possibly both causes and effects of blood cancers. Exposure to certain chemicals. Coming into regular contact with industrial and other chemicals, such as benzene, appears to increase the likelihood of undergoing a blood cancer. Previous cancer treatments. Some blood cancers develop as unwanted side effects to radiation and chemotherapy treatments for non-hematological forms of cancer. Exposure to radiation in a non-medical context. This might include both ionizing and non-ionizing forms of radiation. How is blood cancer diagnosed? Unlike breast and colorectal cancer, there are no screening methods for the early detection of blood cancers. They are often diagnosed based on symptoms in the context of a physical exam. Physical exam. Your physician will document symptoms at the time of your exam. If what you describe meets some or all of the criteria for a blood cancer, he or she will take additional steps to confirm the diagnosis. Blood tests. Blood tests are essential to determining the presence of a blood cancer. One common test is called a complete blood count, or CBC. A CBC documents the relative volume of various blood components, including red blood cells, white blood cells, platelets, hemoglobin, and hematocrit, which is a ratio of red blood cells to plasma. Bone marrow exam. Another test for blood cancer involves a bone marrow biopsy, typically conducted by needle through the pelvis. How is blood cancer treated? Treatment for blood cancer depends on a number of factors, including the disease involved, your age, the cancer's stage of development, and where it has spread in the body. Radiation therapy. Oncologists use radiation therapy to kill cancer cells in a specific area, most commonly with lymphoma. Chemotherapy. Chemotherapy is an effective means of killing cancer cells that have spread from their place of origin. Stem cell transplantation. Radiation and chemotherapy destroy good cells as well as bad ones. This can be counteracted by injecting the patient with stem cells, often acquired from a cancer-free donor. These stem cells will encourage the reproduction of healthy, new blood cells. Biological or immunotherapies. These are newer methods of fighting cancer that enlist the body's own immune system to combat cancer. Surgery. The surgical removal of cancerous organs is recommended on occasion.